welcome to Aces Up Your Sleeve. We are excited to be here with a guest today, and we're going to talk all things autistic medical challenges, autistic medical advocacy. As our usual disclaimer, this is not therapy or therapeutic advice. It's just what we might do if we were in your position and our thoughts on the situation. So our guest for today is Olivia Belknap. She's an ADHD AMFT in private practice in California. Olivia works primarily with clients who are neurodivergent, COVID conscious, LGBTQ+, and living with chronic illness. And I'm your co-host, Kade Sharp.
And I'm your other co-host, Sabrina Longley.
And we're excited to have you with us today, Olivia.
Excited to be here. Thanks for having me, guys.
For sure.
Yeah.
I think this is one of those topics that I always think of it a little bit like the present that just keeps giving, or like the grandma's bag in Halloween Town, where she just like keeps pulling shit out because it's connected to her house. Where it's like, oh, I'm ADHD. Oh, I'm also autistic. Oh, I'm also chronically ill in lots of ways. Oh no, I didn't know that.
So real.
Yeah, and I find people often say like it can't all be the autism. And although we're not ill because of being autistic, like we just have higher like correlations and co-occurring rates of things. So yeah. I don't know, Olivia, if you want to lead us in with what some of those usual higher co-occurrences are.
Yeah, so there are a lot of them that I see in myself and my clients. So Ehlers-Danlos, like hypermobility, joint hypermobility is a really common one. Mast Cell Activation Syndrome is a common one. POTS, postural orthostatic tachycardia syndrome, is a common one. MECFS, myalgic encephalomyelitis chronic fatigue syndrome. I think I got that one right. I always struggle to pronounce that. I think those are some of the common ones. Autoimmune stuff, GI issues in general are ones that I see really commonly as well. I think those are some of the most common ones that I see with autism and ADHD, but there obviously can be other things as well. And a lot of those things, they tend to kind of come in this cluster, quote unquote, all the things, where if you have one of those, there's a high probability you're going to have multiple other of those things as well. And long COVID is another one that I see a lot too.
So they said, we see this group of people has some social struggles. Let's give them the hardest to pronounce co-occurring things. So when they show up to the doctor, it's very hard to express what you think you have.
Yeah, absolutely.
Perfect. Yeah, and things that doctors usually say are quite rare too, like Ehlers-Danlos, like that. If you go in and say, I think I have that, they're going to go, I don't know about that. Or endometriosis, not so sure. Or like certain thyroid issues, Hashimoto's.
Yeah.
What's the cerebral fluid thing, or spinal fluid? That one, Chiari malformation or whatever that is. All of the ones that are considered rare are the ones we have to go in and advocate to like get checked out for, and it's hard.
Which actually like aligns with our pre-assumed rarity of autism in the first place, right? It's like, well, autism's super rare and all these things are super rare. It's like, oh, how many people are we like just missing? And I think that rolls us nicely into like our first question, which is, how can you make them take seriously the sensory accommodations needed? So someone was asking, my son's last sinus infection was creating orbital cellulitis, and he is unable to take medicine orally. And I think like these are kind of the things, right? Is like, okay, well, already we're going to say that it's so rare to have this thing, and now also you're saying that you can't do the treatment for it, right? And then we start getting viewed as like high, what's the word I'm looking for? Like a trouble patient, like, you know, oh yeah, you're so difficult and this and that. How do you usually, when you're working with folks who have like these multiple kind of rare things, quote unquote, and then also the sensory needs to go with it, what do you usually do with that?
I think this is a tough one, and it's kind of similar. Kade and I were talking about this before we started recording, but like a lot of it really depends on the medical professional that you're seeing and their own willingness to hear you and make accommodations. Like it might not have to do with how you're asking or the words that you're using to try and get accommodations. Like they might be understanding. They might be like, no, we don't do that here, or like that's not a real problem, or whatever other kind of dismissive responses might happen. And so I think like just being really clear and straightforward of like, hey, we've tried this, it didn't work, like what other options might be out there, and then just crossing your fingers that your provider is going to be understanding.
Yeah, I know some people on support forums will also advocate for you to, like, if it's a sensory thing around unable to take medicine orally, saying something about like the fillers in the meds or the way it's encapsulated and that could cause a problem. And sometimes doctors will take it more seriously, but it's a fine line between like saying something like that and then maybe saying, well, he's allergic to XYZ, which obviously then they're not going to give it to him in that way. But if there is a treatment involving certain components later on that he needs, that's in his charts that says he's allergic. So you have to kind of walk that balance of, you don't want to lie to the professional, but find a way to inform them so that they take it seriously and understand the gravity of it.
Yeah, definitely. Yeah, I don't take pills well after a situation in my life, and I have had great success at just saying, like, if I try to take a pill, I'll throw it up.
Nice.
My body just won't. It'll just reject it. So, like, you're welcome to want me to take that pill as much as you want, and you can give me the component parts, but if I try to take it as a pill, I will throw it up. And I will never take it. Like, it just won't happen if it's like liquid form, because that's always their next thing is like, crush it up and put it in a thing. I'm like, I will know it's in there, and I hear you. I'm not trying to be difficult, but realistically, if you want to know what will happen is it will sit in that applesauce in my trash can.
Oh, Sabrina, that's so real. I had the same thing when I was younger, and like my parents would try and make me practice like swallowing mini M&Ms or like crushing it up and putting it in the applesauce. And I'm like, probably already had ARFID at the time, so I was like, something nasty like mixed up. No, I do not want that. And I'm not trying to be difficult on purpose. I'm not trying to cause a problem, but I'm like, I physically cannot swallow this. Like, this is not a choice that I'm making.
Right. Also, like, as a person who I used to be able to take pills very easily. And I have very, very severe seasonal allergies. And so I've been on an allergy med as long as I can remember. And so, like, yeah, I wouldn't choose to make it this hard. Do you know how much easier my life would be if I could take Tylenol when I wasn't feeling well? Or if I could, like, you know what I mean? Like, just easily take, like, a medication, or, like, because most of them come in pill form. But that's not actually a choice on my table, so please help me figure out what is.
Mm-hmm.
I always get lost at why doctors don't see it as their job to, like, do their job.
Yeah. Yeah, it's so tough with the sensory accommodations piece too, when it's things that aren't as easily solvable. Like, if there is an alternate medicine or way of like getting that into the person, awesome. But I'm also thinking, on the dentistry side of things, there's so many sensory struggles for many of us at like the dentist, and sometimes there's not much they can do except to offer you other sensory input to distract, or you can go to certain physicians who use the like, I think it's Xanax usually, but like a combination of medications to like reduce your anxiety. But again, you're still facing the sensory thing. So I feel for that person who wrote to us with that. That's hard, especially when it's your kid you're advocating for.
Yeah. I think a lot of times it ends up being parents who are, like, not actually feeling it themselves and trying to best advocate for kiddos who, like, can't express it well because, like, kids don't have the language, which is kind of the point of childhood, right? And it ends up being really difficult. I wonder, like, Olivia, in your work, do you find that there are, like, certain terms that your clients have more success with, or even that you've had more success with, or, like, certain ways of, like, kind of getting around? Like, I know in the fat community, a lot of us have, like, you know, I would like it documented in my chart that you're not going to test for that and that you are blaming my size, right? Or my weight. Like, we have a lot of those kind of things that we'll say to try to get doctors to take us seriously. Are there similar things in, like, the chronic health world?
Yeah, definitely. Definitely agree with the things that you said as well. I think that can be helpful. Like, can you please document this in my chart? Something that a lot of my autistic clients have found helpful with sensory issues. And I know, like, Dr. Megan Anna Neff has talked about this as well, of like partial self-disclosure, of like, instead of saying I'm autistic, therefore I have X, Y, and Z issues, maybe you're worried that they're going to treat you differently after you disclose that you're autistic. So maybe saying, like, I have sensory processing differences, can I please have XYZ accommodation, or like, I need this to feel comfortable in this space, I've found to be more successful. And for some reason, I don't know, it seems like some providers are like more accepting or understanding of that and then framing it as an autistic thing. Because I've had clients where they're like, I told them I was autistic. And then they go into the, well, no, you're not. You can't be autistic because you're, a girl or whatever. Again, more dismissive stuff from providers is unfortunately really common. But I think being able to advocate for the specific need can be more helpful.
Yeah, that makes a lot of sense. And I think that that disbelief, right, kind of goes back to that, like, oh, it's so rare you would never have it.
Mm-hmm.
That I think a lot of doctors I have found are more in that, like, well, the studies still don't show these things in the way, right? Whereas a lot of like mental health providers can recognize like the ways in which the studies kind of haven't caught up, but also the ways in which like there are a lot of things that were actively not studied, and that like we don't really put all of our faith, trust, and pixie dust into like, oh, well, the scientific studies say XYZ.
Yeah, definitely.
Well, and that's not even getting into the like chronic pain history of like fibromyalgia and how that's been used as a catch-all for so many people. So then like the stats might be there, but we didn't know what we were looking for, and it was all just called one thing or two things, or yeah.
Hi everyone, Sabrina here. I am cutting in to your regularly scheduled Aces Up Your Sleeve to let you know about a really exciting event that we're doing for a great cause. So Kade and I are going to be doing an Ask Us Anything event. Really, we're going to do 2 different ones, each for an hour. These are going to be fundraising events to raise funds for my cat Egg, and they are open to therapists. So if you're a therapist and you have ever wanted to ask us anything and get live answers, we would love to have you there. You can register and, make whatever donation you might have, or if you don't have it right now, but you'd still like to come, we'd still love to have you. We're going to do it for 2 different days. So once we'll have it on Tuesday, December the 2nd at 6:30 Eastern. And then we'll also have it on Friday, December 12th at 5:30 Eastern, each for an hour long. And we would love to have you there. You can register for that at radicalinsightsconsulting.com, and up at the top in the menu, there is an Ask Us Anything event, and that has registration pages for both of the events. You can also donate if you would not like to come or you can't make it, but you'd still like to donate. Would really appreciate that, and you are more than welcome to, and there's a link for that on the page as well. If you're not a therapist, then please remember that one of our Patreon subscription tiers is to do a monthly hangout with Kade and I. And so if you're like, oh, I really want some Kade and Sabrina time, you can always go over to Patreon and sign up for that level. Well, thanks so much. I really hope to see y'all there, and back to the listening.
We've got like 2 other questions that were kind of related, so I'll clump them together for us. But somebody had asked, just general advice for people who get heaps of side effects and reactions to meds and are deemed too difficult or hypochondriacs or anxious. And they specified like Mast Cell Activation Syndrome and autonomic function issues. And then somebody else asked, how do you talk to medical professionals about a condition you know a lot about and not be labeled as a hypochondriac or attention seeking?
Yeah, it's a really interesting one. I have a client whose special interest is like medical stuff, and she has a lot of medical stuff. And so that comes up pretty often where the doctors are like, how do you know so much about this? Or like, how are you able to like talk to me on this level of like understanding? But there have been people where they're like, you must have Munchausen's or whatever, like, because, you shouldn't know this much about this. And they're like, well, I have these conditions. And so I wanted to learn about them, but also I'm just genuinely really interested in medical stuff. And I think it kind of similarly to the first question of like, it's maybe is going to depend on the provider that you're seeing. There might be some people who are like, wow, it's so cool that you're informed. Let's talk about it. And there might be some people who are going to make a negative assumption about you based on your level of knowledge. And so if that is the situation you're in, I know clients have had success of like, unfortunately kind of trying to like dumb themselves down, like, or, be like, oh, I've heard of this, but like, do you know about that? Could you tell me more about this? Or, I've heard it's possible for XYZ reactions to happen or for these things to co-occur. Like, do you know more about that? And kind of putting it on them of like, you can kind of like gently sneak in of like, this is something I've heard, or like, is this a possibility? But kind of making it be like the provider is the one that's educating you. Because I think unfortunately some people kind of feel the need for that power dynamic to exist in those kind of situations, which is really difficult.
It like hurts my heart to even think about that being true, but of course I know it is.
Yeah.
And it again reminds me a lot of like medical advocacy for fat folks, right? There's a lot of the kind of like, you know, trying to find ways to get your provider to talk about like what actually might be going on, and not just like, hey, I sprained my ankle, it's because you're a fatty. And it's like, well, or it's because I tripped over the sidewalk. Like I could just be a clumsy. But there's that kind of like, oh, I have to find a way to trick my provider into providing me the services for which I have paid a lot of money and spent a lot of time to come and see them. And it never made sense to me because, like, how do you get through all of med school and you don't like have a special interest about this? How do you do that? And you don't want to just talk about this stuff with someone who knows about it like you do and you get excited. Like, it's so disheartening.
Yeah, it's weird because it's almost like you have to like manipulate them. Like I hate to say it that way, but I feel like in some contexts that is how it feels. And like as an autistic person, like I want to be direct and straightforward and be like, hey, I've read about mast cell activation syndrome and I think this is what's happening for me. Can like, what do you know about that? Would you be willing to learn more, etc. But for some people, like that's not going to be a viable option.
Yeah. And it's almost like the opposite, right? Where it's like, they're like, don't manipulate me into thinking that you have a thing. And it's like, no, I have to manipulate you into thinking that I have a thing because I already know I have the thing. And it's like, it hurts my heart because like I've got really good medical care. Like I've had my doctor since I was 18. And I'm like, she works at a fat positive clinic and like all these things. But it like, that is rare and it is happenstantical that I found her. And like we have already had the conversation that I will be seeing her until she retires. And there's that like almost like you have to keep trial and erroring until you can find a provider who will take you seriously enough, or try out these like, oh yeah, I don't know, I like randomly got this ad for this medication related to this thing, but I don't know what it is. Could you tell me about it, smart doctor person?
It can be so hard though, because sometimes you go that route, you know, you pull a script together, you go in, you're ready to mask and kind of say, oh, I don't really know, is it this thing I've been hearing about? And then the doctor doesn't know about that thing, or knows about it from when they were in grad school 20 years ago, and at that time it meant XYZ only. Like MCAS just meant anaphylactic, like if you're not having that big of a response, it's not MCAS. So I've run into that, and then of course, sadly, some people in those situations, like you don't have the spoons and energy to mask because you're so sick and so exhausted, and that would just take so much more out of you. So the balancing of like, are there times where we can like mask a little, script and prepare, and then are there times where we maybe need to just find a different professional and do the research, not just around the condition, but also around who is a specialist in my area, what do they cost, how can I find some resources to get to that person or someone who works with them or under them. Yeah, that's hard.
Yeah, because like finding another provider might be a great answer, but also maybe you're going to end up with someone who's going to accuse you of doctor shopping. Like, well, you're just looking around for someone who's going to tell you what you want to hear. And it's like, I'm looking around for someone who's going to freaking support me and make sure
listen to me. Yeah, I don't need them to tell me what I want to hear. I need them to listen to what I'm saying.
Right. Because truly, I don't mind if they say, no, it's not that. As long as they can say, it's probably this, and let's explore it, you know? Like, as long as you're not giving me a full dead end, I can usually tolerate that. But it's hard when a lot of providers do give that full dead end sometimes.
Yeah.
It's so interesting how there's already like a term for it too, that you're doctor shopping. Yeah, of course I am. You're a service provider. I will find the one who provides me the service.
Yeah. It's so weird that that's normal for therapy, of like consulting with multiple people and finding a good fit, but maybe not as normal for doing that for doctors or other specialists. It's kind of strange.
Very strange.
Yeah, it's tough because they do sometimes put it in your charts too. You know, I've helped friends and gone in as a medical advocate for them, and when we see some of the documentation, it is not kind things. So these folks asking these questions, like, it's very real, and I hope that's not been their experience, but it's hard to know how to navigate it. there was a podcast episode recently with Dr. Stacy Greeter, who's autistic and a medical professional. And in there, she does a much better job than I can do. So if people want to go check that out, I think it was on the Autistic Voice Project podcast, where she talks about how in med school, kind of the ego piece that y'all mentioned, but also you are meant to know more than like your clients. And if you don't, then that is saying something about you as a provider and your knowledge and just how grueling it is in med school. So I like can see why they do what they do sometimes, but it's no excuse that they're not providing the care that we need.
Yeah. It's also hard because like I've got one of my best friends is a nurse. And like we talk about this often, like her experience in nursing school. And like I think that that's such an interesting thing is like you can't ever know less than a person who walks in. So you have to magically know exactly what they know and then know more about it. And that also breeds this environment of like, I can't say I don't know, which is so dangerous because like for a lot of these things, if they're as rare as like you say they are, then why would you put all of your medical time and attention into learning about them unless that is a population that you specialize in and no one fucking does? Then like why would you know more than a person walking in off the street who lives with it every day, who's had to work hard to like identify it within themselves and then overcome whatever like imposter syndrome, because we all know how great we are as autistics with imposter syndrome, right? And then like to bring it up to a medical provider, the assumption that you would know more than that person is baffling to me.
Yeah. And again, the difference between therapy and some of these other medical professionals, like in grad school, we were told like, if you don't know, don't just like make something up just so that you can have an answer in the moment. Be like, that's a great question. Let me learn more and get back to you. I did that with a client last week. She asked me a question. I was like, I think it's this, but I'm not 100% sure. So I'm going to go ask some colleagues and look into it and get a more concrete answer for you. I'm not going to just like pull something off the cuff that might not be accurate just so I can feel like I'm right in the moment. And I think it's really difficult that when clients or patients are having to deal with that. I think it's something I see a lot, like with long COVID, especially, where they're like, I don't even know if my doctor is going to believe this exists. So if I come in and say, hey, I have long COVID, or I'm looking into this as a possibility, like people might get dismissed like off the bat, which is super frustrating because it is a newer thing. It's not as well known or understood. And, you know, and there is kind of this political aspect to it where some people are like, oh, that's not real. So I think it makes it especially difficult, and especially when it's more common among autistic and ADHD folks, we're already less likely to be seen or heard or understood in these contexts. Now you're coming in with these rare and quote unquote unusual medical issues. Like I think it just compounds the problem and makes it even more difficult for us to get care.
I think it also is so interesting because like I used to talk about this with a supervisor a lot. Like doctors are like allowed to diagnose ADHD, autism, like all these things in a way that like still a lot of master's levels clinicians are like told that they can't, or like all of these things, but like clearly have way less training in it in their programs and after their programs, and especially then a provider who like specifically goes out to learn about these things. But you can diagnose it and I can't. And you don't even know how much it affects the entire immune system to the point that these would be more common, right? And so you have all of this prestige and all of this like like, oh, I'm a doctor, I know all the things. And you have the license to go ahead and just be like, yep, you're autistic or you're not. And that like final say, but you don't even have to actually know as much about it as I do. That shit is wild to me.
And it's interesting that in reverse, although I'm willing to bet, Olivia, that you and I could probably pinpoint anyone walking into our office with hypermobility spectrum disorder or POTS. That's one that you just tell me a few symptoms and I can ask the right questions to figure out. And I've been right 100% of the time so far, There's like certain sleep apnea, certain things that are just higher rates of occurrence in autistic people that we could probably accurately diagnose, but we are not allowed to. And we just say, sounds like things that autistic folks go through, like XYZ. Have you looked into that? You could ask your doctor, would you be interested in scripting that?
Absolutely. I've had those same conversations where I'm like, look, it's not within my scope to tell you that you have this, but I see this really often. What you're sharing with me is really consistent with these things. Like I would recommend checking in with your doctor about this because I can't tell you. But again, a lot of times they're like, yeah, it turns out I have mast cell or I have POTS. I'm like, Yep, it makes sense.
Yeah. With the heaps of side effects and reactions, I'm wondering because like
Let's
this
talk about
person
that.
says deemed too difficult or hypochondriac or anxious. I almost wonder if that's like, um, have you seen it be effective to go like ahead of time? And like when you first start seeing that person, they're going to prescribe you things. Say like, "Hey, I found that I'm actually really sensitive to medications, and that I've experienced lots of side effects in the past." Rather than wait until after, or like, what do you usually see as most effective to almost like curtail some of that like doctor shaming?
Yeah, I definitely think letting them know ahead of time. Like I have a lot of clients where they're like, I am the person that gets that really rare and unusual side effect from this medication. And if you can let them know ahead of time, like, okay, I know you might not see this very often, but you know, when I've tried these meds in the past, here's what happened. So, you know, I tend to, you know, clients maybe need to like start on a lower dose. Again, I can't be the one telling them this sort of thing, but it's like, you know, if you have experiences in the past where the quote unquote typical regular dose will like made your body do a bunch of weird stuff, but half of that dose was perfect for you, definitely share that with your provider, like about your previous experiences. And I think being clear up front is definitely going to be more helpful than not saying anything, having them put you on something, having a weird reaction, and then coming in and being like, I had this weird reaction. And they're like, oh no, like I think being upfront can be more helpful with that.
Yeah.
Absolutely. I have to do that. I'm very sensitive to most meds, and if it says less than 1% of people in the clinical trials had this symptom, I'm going to get that symptom,
Yeah.
and it sucks. But I have to be upfront, and for a while my doctor was like, okay. But then she saw it happen and was like, oh, okay, so now when we try you on a new med, we're doing like the child starter dose,
Yeah.
and then we'll go up after a few weeks to like adult starter dose if you can tolerate it.
I
Yeah.
hate that they play with your life like that though. Like she hears you say it and she goes, "Meh. Let's see if like let's get you one of those awful fucking side effects and then I'll take you seriously." Like that is ridiculous. And if we did that in our practice,
Oh, yeah.
Yeah.
Yeah. Well, and this is a doctor that's pretty darn compassionate, and usually I'm very happy with her care, and if she doesn't know something, she'll usually say, "Let's find a referral for you." Like, other ways she's been great, but yeah, at the beginning, and I think that's part of it too, is we sometimes the more rapport we have with our
mm,
providers, the easier it is to talk about this, but it's so hard to build that rapport if upfront you're getting, like, stonewalled every time you try to say something.
yeah.
Yeah, I have a lot of clients with that same issue, Kade, and I think it's really really frustrating. But just being upfront if you can, and again, crossing your fingers that your doctor is open to hearing you. And yeah, it's so difficult.
I will say, sometimes that, like, quote unquote doctor shopping is helpful because in some of what I've been exploring recently, I got a referral to a provider. Uh, big shout out to like Lavender Spectrum Health in Washington.
Mm.
If anyone needs services, they provide mostly telehealth, and I don't know if it's all, but almost all of their providers are neurodivergent. And so when I said I'm sensitive to meds, that provider said, great, then we're starting you at 1 milligram and we'll slowly work our way up, and that is okay. So they've been so much better, but it takes finding the right people and asking community. So other autistic folks, who do you go to? Who do you trust? Yeah.
Yeah. I think that there's so because we also got a question about like self advocacy tips, especially when you're someone who has medical trauma. And I think a lot of these questions are about like self advocacy tips. But I think even before that, right, like starting out with find your providers through word of mouth, like it sucks and it's hard, but it really is one of the biggest and most important parts about community in general. And like this is a common thing that we like fatties do is like we will talk about it. It's in every like fat group that I'm in. Is like, who are you getting your medical care from? Especially like, I know a lot of trans folks will be like, what places will do surgery without BMI requirements, or like,
Mhm.
there's a lot that has to go into it, and especially because like medical trauma can be so like. I remember the last time that I had to go like the endocrinologist and I brought my nurse friend with me. I love her. She was kind enough to be like, I will come with you to this thing. And it was bad timing anyway. My birth mother was like on her deathbed and I left to come do this appointment and then get back because it takes so long to get the appointments. Like already I'm not in a great headspace. And I was like, I don't want to know my weight. I have not known my weight since I was 18. Like, don't show it to me. I understand if you need to take it, blah, blah, blah. So like They take it, whatever, and she like writes it down on a piece of paper and tries to hand it to me. And my friend like intercepts and takes it. And by this point, I'm like starting to shut down. And then she starts being on about like, da da da, like this medication mostly for your weight management, da da da. And I would like completely, I don't remember the rest of the, I don't remember what she looked like. I don't remember the rest of the meeting. I don't remember anything. And really, it was like my friend who was a nurse who was there and she asked all the right questions. And like, so sometimes we can't be our own advocate and we need someone to be there with us, but we also need to be using those community centers of like, hey, where can I go to get good care? So that we can avoid some of that, because sometimes it just is going to completely shut your nervous system down.
Yeah. Yeah, I know on our bonus content we're going to go a little deeper on that, but I will say that's good point. Bringing a friend, if you can bring someone that appears to be a man, that works. Like sometimes just my presence in a meeting with a friend, like I don't have to do any medical advocacy. Just because I show up, suddenly they're not med seeking anymore. Suddenly they're taken more seriously. And it does not matter the gender of the provider either. Like it's just
Interesting.
you've got that person there. Yeah. So I bet a
car
nurse
shopping and
friend,
doctor shopping. Bring a man or a male presenting, mask presenting person.
yeah. Yeah. And it's sad that that works, but I have seen that be helpful. And when I plan with clients, sometimes it's like, who can you bring with you? And do you have any men that you trust with this information that you would want to bring? Because sometimes it gets us further. I've only had it go poorly once where I think the doctor thought I was trying to like come in and throw my ego around, like, which no. But usually it goes pretty good. So if anyone at home is like, how do I get these professionals to take me seriously? Bring, if you've got a nurse or medical assistant friend, someone who is perceived as a man. Yeah.
Especially like a nurse or medical assistant or like someone who's pretty common with the things, who is like just there to be your backup. Like my friend was very clear on like, I won't speak unless you would like me to. Here is a little signal that we have so that like if you can't speak, and also like I will not be letting you get pushed around here. Like that's not one of the things that I'm willing to watch happen to you. And so, you know, like someone who has a little bit of that like backbone of like, yeah, I'll step in.
Yeah, because it's so easy to shut down in those kind of situations. Like you're saying, Sabrina, like it's so personal, it's so vulnerable. That power dynamic exists in the room where, you know, you as the patient are kind of in this one down power spot. And it makes it really hard. Like I've had situations where I'm like, oh gosh, I really just said, oh, okay, sure, yeah, whatever you're saying is sounds good. Even though inside I was like, no, like it's not going to work for me. I'm not okay with that. I'm not comfortable in this situation, but it's really hard to speak up otherwise. And so I think having someone with you that can be your backup is huge if that's something you have access to.
Yeah. And even like, especially I think to the parents, right? We were talking a little bit about the first question asker, right? I think that's like, especially if you can find someone who you trust to know about your child's like medical, you know, wellness and things like that, is don't be ashamed that like you can't do all the things. It's not your role as a parent, right? But like you have a community of people around you. This is what they're for, right? This is why it takes a village. And if you don't have solid medical providers in your community, like who will take you seriously, you need to bring someone with you who can really place some backup there.
Absolutely. Yeah, I know we're kind of coming up on time for the main episode, so it sounds like we'll be talking ovary pain on the next one, on the bonus content, and medical advocacy, a little bit around like what happens if you get fired by a doctor when you really need care. Is there anything else that's sticking with you two that you just want to say on this main piece before we switch over?
I think just validating for folks, like if you're dealing with weird new medical symptoms, like you are not alone in that experience. Like you deserve competent, compassionate care. If you're struggling to find that, like I understand how difficult that is and how stressful and overwhelming it can feel to have these weird new sensations in your body. And so, you know, for anyone dealing with that, I'm here with you in solidarity.
Really quick, Olivia, could you also just share a little bit about your view of like how helpful therapy can be? Because like therapy isn't the actual medical side, right? But like having a therapist who's well versed in chronic illness, like how important that is.
Yeah, I think that can be really huge. And like, I've had a lot of clients come to me and they're like, when I've shared with other providers, here are my diagnoses, they've never heard of half of them. And then when they come to me and they're like, you know about mast cell activation syndrome? Like, you know about POTS? And I'm like, I have POTS. Like, I know about POTS. So I think that can be really huge. And it's like, you know, are we going to like fix those physical problems in therapy? No, but like having a compassionate person who understands what you're going through, who can validate you when the doctor is dismissive and be like, they're, you know, talking some BS right now, like that's not okay, like I think is really huge. It's like just having another safe person in your corner to process those things, especially with medical trauma, which can be really hard. Maybe we'll talk more about that in the next one. But I think that can be really tough because it's like this ongoing thing, especially with chronic illness. It's not like one and done. Like you have to keep going into these medical settings. So having someone that you can process those things with, have a plan of like what are comfort items you can bring, how can you sensory soothe when you need to be hospitalized or whatever things, like I think therapy can be really helpful for that kind of stuff.
Totally agree. Yeah. Where can our listeners find you?
Yeah, so you can find me my therapy Instagram, Olivia Belknap Therapy, Belknap. The K is silent. You can find me on there if you want to see more of my work, or my website, oliviabelknaptherapy.com. I see clients in California, currently full at this time, but you never know when I might have openings, so feel free to reach out if you want to connect.
Awesome.
Well, thank you. Yeah. For our listeners, you can expect new episodes weekly on Tuesdays. And like Olivia said, you can find her at oliviabelknaptherapy.com or at Olivia Belknap Therapy on Instagram. I'm over at cryptidlearns.com, and Sabrina's at Radical Insights Consulting on Facebook or Instagram. If you have any questions for us, please visit neurokink.org/AUYS and send it our way. And we're going to jump over to Patreon to record our bonus content called Hit Me Again with our guest. And we'll be exploring more around self-advocacy, like we said, especially for folks with medical trauma, and how to navigate getting, like, quote-unquote, fired by a doctor when you need care. So that's over at patreon.com/acesupyoursleeve podcast. We hope to see you there.